what happens when you have cancer, any form of cancer, the doctor doesn't say to you, these are the cures. The doctor says to you, what cure do you want? What treatment protocol do you want? Now I'm sitting there, and my wife is sitting there, Evelyn, and we are the most uninformed, uneducated people in the medical field, and we are now making decisions on our lives, on my personal life. And I have no idea. Well, we can do radiation. That sounds exciting. We can do surgery. Sounds exciting. We can do brachytherapy. What? What's brachytherapy? Oh, that's those seeds we put in. Okay. We can do HIFU. What's that? Well, all of these different treatment protocols are out there, and you have no idea as a patient going in what these are. So then you kind of recover, and you go home, and you think about it. And then I came back and I said, okay, I think because of the aggressiveness of the cancer, what I'm going to do is go for surgery, because if the cancer returns, and it can, then we can take a look at doing radiation later on. So I go in for surgery. I'm in for some 5.5 hours. And after I'm there for 5.5 hours, I come back at about 10 o'clock at night to my room, and Evelyn is there, and she said, well, they said they got everything. And I go, wow, that's great. And for the next, I would say, year, they got everything. And then what happened after that first year, my PSA started to rise again. And you say, well, how can your PSA be rising if you don't have a prostate? Well, there's a couple of things going on. First of all, before surgery, they give you a regular PSA test, which is a normal test that shows the standard ranges for PSA. After surgery, they give you a hypersensitive test. And what they were finding in my blood was that my PSA was 0.02. It was at that level. And the doctor said, well, you know, the good news is this is one of the few tests that we have in the entire field of cancer that can tell men if something is returning. He said, no other cancer can do this. He said, but prostate cancer you can. It was pretty exciting. It was kind of like, okay, fine. I said, now what happens after this? He said, we're going to watch it. And he said, once it starts to get up to 0.2, he said, then we're going to talk about what we need to do. So as of, let's see, January of this year, that number went from where it was 6 years ago to 0.13. And that was time to do radiation.